Hello, I'm Dr. Alan Lawrence. Welcome to Breezing Through Menopause, slideshow number 4 on osteoporosis. In this slideshow, we'll look at a major issue associated with menopause, osteoporosis. We will look at the causes of osteoporosis and how it can affect you. Our goal here is twofold: to provide information on osteoporosis and also to help you prevent and even reverse osteoporosis. Before starting on our presentation of osteoporosis, let's review what menopause is. Menopause is the end of menstruation and when fertility comes to an end. This usually occurs between ages 45 to 55, and it is a natural occurrence marking the end of the childbearing years and can be the beginning of one of the most productive periods of life for women. While osteoporosis can occur unrelated to menopause, it appears that in many women, osteoporosis is accelerated by the onset of menopause and by the lack of female hormones, estrogen, progesterone, and the male hormone testosterone. Osteoporosis is a disease of the bones. With age and with the loss of estrogen, progesterone, and the male hormone testosterone, many women will find that their bones become weak and may easily break. This can lead to fractures, prolonged healing, and even in some cases, premature death. With the onset of osteoporosis, there is a progressive decrease in the density and strength of some or all of the bones of the body. Osteoporosis can occur as bones lose their proteins, calcium, and other vital bone minerals. As bone is lost, the remaining bone loses its strength and its ability to support and protect us. Osteoporosis predisposes the affected bone to fractures, a broken bone. When osteoporotic bone fractures do occur, they reduce the woman's ability to heal, and healing may be slower, imperfect, and leave a weakened and disrupted bone. Osteoporosis occurs more commonly in older adults, particularly postmenopausal women, although andropausal men and other individuals using steroids can also suffer from osteoporosis. Unchecked osteoporosis can lead to changes in posture and other physical abnormalities, including hunching of the back known as dowager hump, and decreased ability for the back to function correctly, as well as chronic long-term pain. In this slide, we see the microscopic differences between a normal bone on the left and an osteoporotic bone on the right. Notice that there are increased air spaces and that the bone on the left looks more solid and stronger than the bone on the right. If one looks closely, you can see that the bone on the right looks much weaker than the bone on the left. In this slide, we see 3 of the most common types of osteoporotic fractures: spinal fracture, hip fracture, and wrist fracture. The spine is made up of a number of vertebrae, each one on top of the other, that act to support the body and are essential for helping you sit and stand, move, bend, turn, and lift. Fractures of the spine can lead to chronic back pain and even heart disease. In this slide, we see that osteoporosis fractures can occur in just about every bone in your body. Breaking a hip, a leg, ankle, wrist bone, or one of the bones of the spine can negatively affect you and change your life forever. It can leave you with severe pain and the possibility of even permanent disability. It can make life extremely difficult, with loss of ability to perform daily tasks such as walking, shopping, lifting, bending, even driving on your own. Of those women who survive, many will have lasting functional disabilities, including confinement in a hospital and later possibly long-term stay in a convalescent or physical therapy facility. Some may become wheelchair-bound, and others will end up having to live permanently in a long-term care facility. Collapse of the spine can cause dowager hump, chronic back and extremity pain, and predispose to respiratory disease and breathing problems, as well as coronary artery disease, heart disease, and physical emotional suffering. In this slide, we see the same woman when she's young on the left and older on the right. In the older version, she's already developed osteoporosis with multiple collapses of her vertebra, causing sloping of her shoulders, change in the curvature of her back, scoliosis, loss of height, leading to issues such as back pain, formation of the dowager hump, and protrusion of the abdomen. These changes listed here may take years to occur. They may happen slowly and may not be recognized until it is much too late to prevent them. In determining the likelihood that any one woman will develop osteoporosis, there are risk factors which can be controlled by the woman in order to prevent osteoporosis, and others which cannot be controlled by the woman herself. In this slide, we see a list of a number of risk factors that, while possibly difficult to control, women have some power over. While they may be difficult to control, prevention is still possible with appropriate medical treatment and support. Regular follow-up by a competent medical doctor can help find medical problems early and treat them so that the risk of osteoporosis is decreased or hopefully even eliminated. In this slide, we see a list of factors that women have control over. For example, reducing the consumption of alcohol, avoiding sedentary lifestyle by creating a regular, daily, weight-bearing exercise program, stopping smoking, and reducing caffeinated beverages such as sodas, coffee, and teas. And of course, reducing stress in your life. If you are at high risk for osteoporosis, or your bone density screening shows that you have early evidence of osteopenia, that is minimal bone loss, or you are already suffering from osteoporosis, then strict control of these factors listed above can prove to be beneficial to preventing further worsening of your osteoporosis. Along with the need for a regular weight-bearing exercise program and avoiding alcohol and smoking, eating certain foods can help you to prevent osteoporosis. Make sure that your diet has adequate amounts of calcium, magnesium, and vitamin D, or that you're taking supplements of these essential nutrients to ensure that you are not deficient in them. There are a number of other vitamins and minerals which do support maintaining excellent bone strength, such as boron, vanadium, and strontium, each of which can be found at your local health food store. Also, it is important to avoid drinking soft drinks which have elevated levels of phosphoric acid. So learn which soft drinks you are drinking that might by reading labels and checking this out before you drink them. There may or may not be warning signs that osteoporosis is occurring. Some of the common warning signs are loss of height, change in posture with slumping or hunching of the shoulders or back, or sudden onset of unexplained back pain. Additionally, if you are 45 years of age, or you're a postmenopausal woman, or you've had a fracture of a bone with even a minimal injury, then you may be developing signs of osteoporosis. If so, talk with your doctor about a diagnosis and starting treatment. In our next slideshow, Prevention and Treatment of Osteoporosis, we will discuss the use of hormone replacement therapy, HRT, and estrogen replacement therapy, ERT, as well as nutritional therapies for preventing and reversing osteoporosis. Come, join us and learn what you can do to reduce or eliminate your future risks of developing osteoporosis. We want to thank you for listening to our Breezing Through Menopause, program number 4, Osteoporosis. This has been a presentation of Health Education Associates of Palm Springs, California. Thank you again for participating. Have a wonderful day and a wonderful life. This is Dr. Alan Lawrence for Health Education Associates, wishing you the best in life and good health.